Hello, and welcome back to the Advancing Healthcare Innovation Show. I'm your host, Michael Stamatinos. And if you're new to us, welcome. We're super excited to have you here. We're bringing some really exciting conversations with just some incredible leaders that are painstakingly reshaping the future of healthcare. And we're passionate about a few different areas. We're passionate about access, we're passionate about innovation and leadership and the adoption of these innovations. And if it's your first time tuning in, let me just take a really quick step back and give you a little bit more of the lowdown, the rundown of what we're trying to get done here. So, our focus is on bringing real stories of innovation to life, not just the stuff that you read theoretically, but like real people that are really in the trenches getting work done and giving them the opportunity to share some of the wins and also share some of the learnings. And in doing that, in sharing this with our community, ultimately, with the world, we hope that those that listen can take and apply these lessons and continue to make things better. And we've got some amazing, incredible, upcoming conversations that are coming up. And if you haven't checked out any of our historical interviews, however you're consuming this, if you're watching this, if you're listening to this, please hit the subscribe button now so that any of the new interviews come directly to you. So there are people that are in healthcare who talk about improving the system. And then there are people that step inside of it, roll up their sleeves, and actually do the work. Dr. Mohammed Quadri is one of those people. He's a physician by training. He understands the business side of healthcare, and he brings a level of discipline to his work that you actually don't actually see too often, especially in a system that's very complex and at times is fragmented. He's the VP of Strategy for Academics, Research, and Innovation at Hackensack Meridian Health, one of New Jersey's largest healthcare networks. And he sits sort of right at the intersection between care delivery and operating, what makes things real and what doesn't. He sort of sits in that realm. And I think what I find most fascinating about Dr. Quadri, he's kind of like a Swiss Army knife in terms of the arc of his career. Uh, 18 years inside one system, seeing how it evolves, pushing things forward, leaning in when things are getting really challenging, when to work within it. That's kind of rare. So that's not easy to do inside a large organization, which I find very, very fascinating. So today, um, selfishly, I'd like to learn a little bit more about what what does it take to drive innovation ahead in such a large system, from the inside, giving us that perspective. What does it cost in terms of time, energy, people, all of the things that need to happen in order for initiatives to move ahead? What do those things require? And as a result of that, what are some of the little wins? And also, what are some of the things that he secretly is like, yeah, wish we could kind of forget about that, but here's what we learned. So, Dr. Quadri, welcome to the show. Good to see you.
Thank you so much, Michael. I love the energy you carry on this show. And, I hope to bring the same energy in return. And I'm excited to be on this show. And you bring in like some phenomenal speakers. I hope to live up to the expectation.
I'm sure you'll exceed it. So before we kind of get into everything that you've been working on, I kind of want to go back. You trained as a physician, you came through sleep medicine. 18 years later, you're VP strategy and one of the biggest health systems in New Jersey. Most people today, they don't stay anywhere for 18 years. Um, what kept you?
I think the fact that the longevity of an employee in a large health system like Hackensack Meridian Health, which has 18 hospitals, 500 plus outpatient locations, 40,000 plus team members, and growing in itself speaks lots of volume,
It does.
right? It also talks about not only employer-employee relationship, but the effort that the leadership at Hackensack Meridian Health puts in place to retain, recruit, and at the same time maintain employee satisfaction.
Yeah,
That's a very essential component, Michael. If you actually think about it, um, your employee satisfaction drives patient satisfaction.
100%.
Someone told me you cannot really motivate people. You can only inspire engagement. When you inspire
Mm,
engagement, you keep them motivated. Motivation comes from within. So it's the self-motivation that
yeah,
requires a leader to actually inspire engagement. When you actually spark that light in them and help them understand their passion, in an environment, in a complex environment like healthcare, you will see people who are functioning in three different capacities. One is a job, 9 to 5.
right.
Two is like it's a profession because they got trained in it. Three is calling.
Hmm.
When you see employees working at a health system for more than 20 years, 15 years, 40 years, I have seen employees, leaders who have been at Hackensack Meridian Health for 45 years. That
It's
speaks
amazing.
volumes.
It does. Yeah.
That's because of the opportunities it provides while making sure that we keep our patients safe. We provide and meet the community needs at all times.
Dr. Quadri, I came across something that you said about earlier about surrounding yourself with people who push you to be better. Who, curious, who was that person for you early in your career? And then what did they see in you that at that time you couldn't actually see in yourself?
The attribution to my success, of course, I'm thankful to God for everything what I have achieved in my life, and also all the mentors, coaches that have supported me throughout my career, both
Yeah.
personally and professionally, and helped me grow. There are countless people. The journey begins with my father and my mother back in India.
Mm,
My father was a physician who was known as the doctor of the poor. He never charged anyone more than 3 rupees. He, to the extent, actually bought medications for his patients while he himself was cash constrained.
wow.
He served in underserved communities in three different clinics. And that in itself taught me how to serve people and keeping the patients at the center of the care you provide and the business of medicine you are in is an essential component.
Mm,
So that came from my father. My mother was an army school teacher, and I grew up in an environment with kids whose parents used to serve in the army, navy, air force. And
right.
in India, there are multiple different schools that cater to the needs of these kids because many a
Hmm.
times, the defense folks, they travel a lot. So they
Yeah.
need
Yeah.
an environment, stable environment, learning environment. So my mother was a teacher who taught social studies in the school, and she taught me discipline. She taught
Hmm.
me diversity in unity
Mm,
or unity in diversity. She actually helped me understand what does it take where people talk about the elevator effect now, where everyone is
hmm.
going through their own problems.
Right.
What does it take to understand a human being while being human, which is an
Yeah.
essential component of life?
That's right.
The irony of life is it doesn't teach you life. It's the experiences that we carry throughout our journey teaches
Yeah.
you life. And if we make an impact, positive impact on someone else's life, that's more satisfying than anything else. I can tell you, Professor Topazov, who used to teach me surgery in St. Petersburg, Russia, He told me once, Mohammed, be open to opportunities. Professor Makarov, who taught me what does it mean to actually accurately close wounds while I was in medical school.
Hmm.
I'm just naming a few, but I'll tell you the list goes on and on and on.
Yeah.
I had a mentor and a coach, Diane Arrow, who was a chief nursing officer at Hackensack University Medical Center. I had a mentor and a coach, Darlene Cox, who was a White House fellow and also used to oversee patient experience and service excellence. I had colleagues in various different capacities in different divisions from whom I learned that every aspect of life counts, every
Yeah.
act makes an impact on the lives of humans we serve. So I'll
What
stop
a
here.
yeah,
Otherwise,
what a nice contribution to that, and the people that you surround yourself with absolutely impact you long term. And it's cool that, you have parents that poured into you like that, because obviously it's carried and stayed with you. Those lessons have stayed with you, and hopefully you continue to pass that on to people that you mentor, kids, etc. I want to shift gears for a minute because it seems like you're very entrepreneurial. So being entrepreneurially minded inside this larger organization because you co-founded the HMH Research Institute. And on paper, it sounds like an amazing story. In reality, I'm just sort of thinking, what was the hardest conversation that you had to have in order to make that sort of mission, that initiative happen?
that's a very loaded question, but I will tell you this. Having worked in different capacities at Hackensack Meridian Health, wearing multiple different hats
Yeah.
over the last 20 years now, I actually joined Hackensack Meridian Health on October 23rd, 2006.
Hey, right on my birthday.
Oh,
23rd is
wow.
my
Happy
birthday.
birthday.
Let's go. Let's go.
See, there is a reason and rhyme why people meet, right? And God has its
Yeah,
own
yeah.
to connect people. But I'll tell you, in the past 20 years, I have learned two things. One, to surround yourself around smart people because it only makes you look smarter.
Don't give
And
away my secret.
and also, one needs to be agile, nimble, flexible enough
Hmm.
to be able to adjust your strategies in real time, rapidly and accurately. Currently, as you know, a lot of innovative solutions that are coming out. Everyone has a laptop, everyone has access to AI powered solutions where they can potentially come up with a new solution that they think will address unmet need in real time, rapidly and accurately.
That's right.
When we were sitting together with one of my mentors, coach, and currently my direct supervisor, for whom I have utmost respect, Dr. Ihor Sachak, who is also a urology surgeon by profession. He sat with me in a room when we were thinking about how we can advance academics, research, and innovation at Hackensack Meridian Health, where we had two different systems that recently merged. Then we
Hmm.
merged with a third system. And by virtue of merger itself and the time it takes for integration, as you know, systems remain in silos for a period of time.
Yeah.
But as the integration happens from different levels, right? Cultural integration, clinical
Yeah.
integration, financial integration, there was a need for us to bring everything under one umbrella. So we created Hackensack Meridian Health Research Institute with the board's approval. And with a sole mission and a vision, we wanted to create a connected ecosystem that not only accelerates scientific breakthroughs and discoveries, but bridges the gap between academicians, clinicians, scientists, investments, innovators, startups, funders, and founders, solely with the purpose to meet unmet clinical needs in real time, rapidly, and accurately. Technology grows exponentially.
Hmm.
Adoption rate remains flat. I'm on a journey to bridge the gap between investments, innovations, and adoption.
So
Adoption is the last mile.
it is the last mile. It's the hardest. Like we don't have an innovation problem. We have an adoption problem. So let's just say you want to improve the bottleneck, loosen it up and make it better. Like walk me through how you actually get something done inside a system like Hackensack Meridian. Do you have an example that you're able to cite? Like what's the actual play?
So, like any other health system, there is a hierarchical approach in how we actually evaluate problems and identify solutions. By the way, over the years, I have actually learned how you define optimism and pessimism. An optimistic person is the one who comes up with solutions amongst problems, and pessimistic person always looks for problems among solutions. That's how I define those two
Mm,
individuals. And you'll come across them a lot across, throughout your journey of life. But in healthcare, we have a culture in healthcare that worships the idea. Every entrepreneur is a legend in their head. That's the best idea, and they think that they are bringing the value proposition and creating a competitive edge and advantage that differentiates them from other innovative solutions out there
right.
without an ability to understand or holding hand of a patient whether it actually solves the problem or not.
That's right.
There are clinicians, allied healthcare professionals, phlebotomists, environmental services, people who solely focuses on process improvement, improving operational efficiencies, clinical decision supports, electronic health record systems, and the list goes on and on and on. But I have seen many innovative solutions with beautiful science, zero adoption. And there are multiple different reasons why they fail.
Hmm.
The graveyard of health tech is full of well-funded companies.
That's right.
72% fail.
Is there a theme of the failure that you can pinpoint in terms of why the adoption doesn't occur? Is there like a common denominator in most cases? And if so, like what is that common denominator so that people can avoid it?
Lack of embedding the solutions within the existing workflow is number one theme, in my opinion. An ability to improve efficiencies without creating a complex environment and add to the existing burden of work,
Mm,
be it from clinical documentation perspective or be it from adding a new solution. It could be as simple as a fingerprint uh, testing that will add an additional layer to the existing workflows without getting the buy-in or having a physician champion or a clinician who actually understands the unmet clinical needs. I think those are the most common key themes that I
mm.
have seen over the years.
It's amazing to see how you can try to move a company ahead without having I'll call it multiple anchor points, whether they be clinical champions, administrative champions. I just don't see how that's such a common oversight. It just seems very simple to me, but sometimes simple is hard to execute on.
Absolutely. Yeah. I'll take my personal example, right? Uh, I, I am a researcher, as you know, a sleep disorder researcher and metabolic health,
Hmm.
journey to improve metabolic health. One of my research includes developing breath-based biomarkers. I'm on a journey to actually like potentially come up with a breath analyzer that will allow us to predict drowsy driving and prevent road traffic accidents associated with
Yeah.
it. In the state of New Jersey, there is something called as Maggie's Law, where a young child, Maggie, was, died because of a road traffic accident, uh, just because the driver was sleeping on the wheels.
It's amazing because I think a stat I read in prep for this conversation was like sleep disorders affect, I think it's like over 30 million Americans, and they contribute to it's like 100,000 drowsy driving accidents a year. Like most people don't even connect those two things. And it just seems like you see that problem so clearly.
Yeah, and it's beautiful science, right? And it's more than 100 million people that now have one or the other sleep disorders. And many people don't know that there are almost 90 different sleep disorders that are described by American Academy of Sleep Medicine, but most commonly is obstructive sleep apnea that is being diagnosed on an ongoing basis and sometimes misdiagnosed as well or underdiagnosed as well. But when I talk about breath-based biomarkers, which is beautiful science, but the adoption is a question, right?
Mhm.
Where does this fit in a patient's journey?
Yeah.
Who orders it? Who reads the results?
Hmm.
If we cannot answer these simple questions, why the science does not matter?
Mm. So then, kind of going back to this study, if the RISE study works at scale, well, I'm sort of curious, what does the world look like? How does the world look differently in, I'm just trying to think, maybe 10 years time? And not in like a press release way, but like what actually changes for a real patient?
So the RISE study is not solely focused on a patient's journey. It's also focused on making an impact to the communities at large. The RISE study certainly helps you identify patients with sleep apnea with excessive daytime sleepiness and at risk of drowsy driving.
Mm,
But the indirect impact is the mortality associated with road traffic accidents, where patients or human beings who are involved in road traffic accidents are not necessarily patients. They may be healthy individuals.
mm, hmm,
So that's the impact one has to understand. And for to every innovative solution, you asked a very important question: what are the key barriers while adopting to new innovative solution? One is the clinical workflow balance. The other one is the economic alignment wall. Healthcare is not a free market in any normal sense.
right.
Reimbursement drives behavior.
That's right.
We all talk about accessibility, affordability. We all talk about integration. We all talk about pricing transparency. Going back to my life's journey and about when I talked to you about my father never questioned anyone whether you have money to pay for the care. He first provided the care.
Hmm.
If a payer will not cover it, a hospital cannot sustain it. If the ROI accrues, to the wrong stakeholder, say the insurer benefits, but the hospital bears the cost, adoption dies.
Yeah, it has a finite runway.
Yeah. So that's the second layer of barriers or challenges one needs to overcome. The third layer is trust and the change management wall. Healthcare is a conservative culture by design.
Hmm.
We are trained to do no harm. We talk about
Right.
it. That means physicians are rightly skeptical of new tools, or clinicians are skeptical of new tools.
Hmm.
They want peer-reviewed evidence. They want to see a respected colleague using it,
Hmm.
and they want reassurance that it will not harm their patients or their workflows.
That's right.
Founders underestimate this. They think an FDA clearance or a published trial is enough. It is necessary, but not sufficient.
Mm,
You need a physician champion, someone who will put their reputation behind your product.
yeah. I mean, the
And
credibility is everything. It's got to transfer.
absolutely. And you need to earn that trust, not buy it
Yeah, you can't shortcut that.
by no means.
I want to keep talking with you for hours, and I know that I can't because you're a super busy guy. But before I forget, can you maybe just sort of share a little commercial for Hackensack? What's the best way for people to follow your work, the research that you and your team are doing, and then we'll wrap up.
Um, I think Hackensack Meridian Health is certainly one of the most innovative healthcare system. And having worked at Hackensack Meridian Health for over 21 years, we have ability to care for patients, not only to provide them the best accessible and affordable care, but at the same time, access to most innovative solutions out there. We have subject matter experts, clinical experts who may be able to address some of the most unmet needs and help patients to solve them in real time, rapidly, and accurately. I would also say, like, if you want to learn about Hackensack Meridian Health's research, please feel free to log on to the website. There are multiple different resources, social media channels that are available where you can learn about all different aspects of academics, research, and innovation at Hackensack Meridian Health. Thank you very much for having me. And I want to end by making two final comments. One, which I always say, one is folks out there do not collaborate to compete, compete to collaborate. That's where the
Mm.
power of collective intelligence lies. And I have a simple philosophy. I'm a Sufi at heart. Give to the world the best you have, and the best will come back to you. Thank you, Michael, for having me.
Dr. Quadri, there have been so many golden nuggets in this conversation. It's like ridiculous. Inspired engagement. I just the list goes on and on and on. But I think what has been most impressive is your clarity and the principles that you operate on and how they can be applied to honestly any environment. And that kind of carried through throughout the whole entire conversation. I can't wait to personally to kind of go back and just take even more expansive notes and then to be able to sort of share that with those. So if you're listening to this and you found this conversation to be really helpful and fruitful, there's only one ask. Would you mind sharing it, liking it, commenting on it? Share this with the community, share this with your network, because that's actually what's going to create more opportunities for those to continue to make things better. And if you think there's a topic that you want us to explore or a leader that you want us to interview or hear from, please drop me a note, leave a comment. We do read them. This is a platform that is absolutely about community. It is bi-directional. It's an ecosystem. If you want to eat from the ecosystem, you have to consistently feed it. So it's not just about content. We want to make sure that we're feeding the ecosystem. So thank you for listening. Keep building with purpose, and we'll see you next time on the Advancing Healthcare Innovation Show.
Thank you, Michael.